So we are going to be doing a mini lift and neck lift on my lovely patient today. She's in her early 50s, and what's concerning her is all the extra skin she has down here. So she actually told me something wonderful just now. She said she's stopped tanning since she was 19 onwards, and you can see how nice her skin and how her face is held up beautifully. So, however, this part has continued to sag. So we are going to be doing a neck lift where we're going to improve all of the extra skin down here. We're also going to do a mini lift on her to help pick up some of the little bit of jowling that she has over here. And then, would you mind just telling us kind of what's bothering you?
Yes, I hated the sagging, and my mom, unfortunately, I have her to look to, and she has a lot of sagging. So, although I stopped tanning when I was 19, I, have this, and no matter what creams I put on, I even went so far to use neck tape for special occasions. So this has been bothering me for a long time now. So I'm gonna do something about it.
And then there are options to have the procedure done under local anesthesia with oral sedation or under IV sedation with anesthesia. And then you decided not to go that route.
As a nurse, I feel if I can avoid general anesthesia, I think that's my best option for me. And I'm all for this without general anesthesia. I think it's safer.
Great. So we are going to get started shortly. She's been medicated already with some Valium, and we'll show you what we can in the operating room.
Awesome. This was a great experience.
Oh, we're so happy to hear that.
I am so happy that I got this done, and it was tolerable, and everybody made me feel comfortable, and Dr. M was completely professional and reassuring throughout the whole thing.
With a whole bunch of fancy stuff in there.
I just had the procedure done yesterday. A little sore and some tightness, but completely manageable with Tylenol only. I did great. I'm lucky I have a bed that adjusts, so I slept upright, and I actually slept and did okay. It's a little hard to chew, but that's normal. So I'm really very pleased with how my post-op first night went.
Your pain level last night was pretty tolerable?
Very tolerable.
And you're not taking the pain medicine. You said
No,
Tylenol's controlling?
Tylenol was controlling.
That's
fine.
fantastic.
I took one dose last night.
Great.
And another this morning.
And you slept with your head elevated?
I did.
Awesome.
Yes.
Awesome.
And I made it through.
Great, great. Any suggestions, complaints, concerns?
No, just you do feel a tightness in your neck, which is normal, and a little soreness.
Okay, yeah.
It is manageable and
Great.
Tolerable. And I didn't have general anesthesia, which I'm thrilled about.
Yeah, no, that's great. It's much easier for the recovery and just on your body in general.
Yeah.
All right, so I'm going to slowly take this off. I apologize if there's any
That's all right.
pinching or anything like that. You should actually even feel better after this thing is off, too.
Yeah.
Alright. So I'm going to remove the drain from this side. It's just a little Penrose drain. It's just going to pop right out. Okay, 1, 2, 3. It's out. You okay?
Yeah.
Awesome. Alright, so I'm going to switch sides over here. And I'm going to do this. Okay, so what you want to do for your cleaning, you're going to use a mild soap. We suggest Cetaphil.
Okay.
Okay, if you don't have this, baby shampoo is sufficient, or even like a very generic dial, like antibacterial soap. Something that's mild, no scents, nothing like that, because it'll burn and be uncomfortable. Okay. So what you're going to do with that is we suggest using gauze pads. Okay, if you don't have any, I'm happy to send you home with a few. Get them nice and wet. And then put some Cetaphil on the gauze pads. Make it nice and sudsy. So I'm going to go ahead and do that. Pour a little on there.
So I can just use regular tap water.
Yeah, yeah. Get it nice and sudsy. And then just gently clean the incisions. You don't have to be rough, obviously. I'm gonna probably be a little more aggressive than you need to be, just so I can get off any of the dry blood or anything like that.
Great.
But it's really just very gentle, wiping over all the incisions. And the incisions are in the hairline, around the tragus, under the earlobe, and in the crease behind the ear, and then back into the hairline just a touch, okay? And before I wrap you up, I'll go ahead and I'll give you like a 360 on your phone too.
Thank you.
Yeah, of course, you're welcome.
So I won't video it.
So that left side had a little bit of bleeding on the incision line, so if it's bleeding a little, I'll clean it up before you take that side.
Looks so good.
One month. I had a mini face and neck lift. Great, so happy with the results. I love looking at my neck in the mirror. It's a little obsessing, but I love it. To do it if they can. It absolutely was the best decision I made for myself in a long time. So if you can do it, do it. My surgery, I took a picture while I was waiting, and I made my neck look the worst it could possibly look. But look at the difference between that, okay, and this. It's amazing, okay? Even when I can't try to recreate that, obviously.
No.
But isn't that amazing?
Yeah, that's great.
I know, so.
So that's just you healing
And
over
this
that
is
3 days?
this is me, like my normal position neck. Look how much better. It's amazing. I've been sending all these to my friends. I cannot talk about it. My healing too has been great. He's meticulous and has integrity, which I love in a physician. And the staff has been wonderful. And I mean that. I really do mean that. I can't tell you how happy I am, because this is something that's bothered me for the last 10 years. And like I said, for my wedding day, 6 years ago, I actually taped my neck up.
Oh, wow.
So, like, it's such a stupid, superficial thing for some people. I know they might think that, but for me,
That bothers you.
it bothered me.
Yeah.
So,
well, we did it in a safe way. It's not like.
and I love no anesthesia.
Good. So,
And I only took Tylenol. Thank you very much.
you're welcome. Thanks for choosing us.
Thanks for having me.
We'll chat in another week, okay?
Okay.
You're welcome.